Hello and welcome to North Staffordshire Combined Healthcare NHS Trust Strategy for 2020 and beyond. We're a trust which prides itself on achieving the best possible outcomes for our service users, and this strategy outlines our ambition over the next 4 years to achieve that. Significant progress has been made over recent years, which culminated in the trust being rated as outstanding by the Care Quality Commission. We are one of only a small number of trusts to achieve this standard and one of only 2 mental health specialist trusts to have done this. We're very proud of this achievement, of course, and have continued to make significant progress towards improving health outcomes and reducing health inequalities for the communities we serve. Our updated strategy sets out our sustained commitment to continuously improve services and takes account of national requirements and, of course, local priorities. The NHS Long-Term Plan, published in January 2019, placed particular emphasis on the expansion and extension of mental health services over a 10-year period. We will therefore have continued focus on quality, people, partnerships and sustainability to ensure that we can achieve those commitments through safe and effective services, which will enable our communities to live their lives fully and well. The NHS Long-Term Plan also has a strong focus on joining up primary, community, mental health and acute services, together with new governance arrangements which will support providers to have greater influence on service improvement and integration. The Trust's established partnerships with other NHS providers, commissioners, local authorities, police and third sector organisations, together with our proven success in collaborative working, puts us in a really strong position to take a leading role in shaping the future design and development of services across Northern Staffordshire. Our staff already deliver excellent care and treatment. They are compassionate and committed to helping service users and their families. Through this strategy, we'll continue to create a culture where they feel encouraged and supported, as well as being empowered to find new and innovative ways to improve care delivery and supporting services. We know that health and care services continue to experience pressure and resources can be scarce. Our organisational strategy will support us in making the best use of resources by focusing on sustainable healthcare to generate financial, environmental and social value. The Trust has recently been confirmed as one of only 24 trusts to be included within the National Digital Aspirant Programme. Alongside our existing progress as part of the Lorenzo Digital Exemplar Programme, we've a clear direction to help us realise the NHS long-term plan vision for digitally enabled care. We, of course, also look forward to working with our service users, staff, board members and our broader partners to deliver this strategy and further improve the care we deliver. Detailed plans and further information on each of the 4 strands of our strategy is available via our Trust website, and we really hope that you find this useful. And we'll be carrying out one of the most extensive engagement exercises Combined has ever undertaken with staff, service users, families and all of our local partners and stakeholders, so that we hear as wide a range of voices, insights and opinions as possible as we look to introduce and embed the fantastic outcomes and innovation which are built into our refresh strategy. So many thanks for taking the time to learn a little about our aims, ambitions as we look beyond 2020. I really look forward to hearing your views and working with you all as our fantastic future unfolds.
pleased to introduce to you our quality strategy. This is a key organisational strategy which describes the priorities and methodology for how we as an NHS Trust will continue to deliver services which aim to meet the needs of our local population over the coming years.
Following the CQC inspection of the Trust in 2016, we received a good rating and immediately launched our campaign towards outstanding. This set ourselves the aim of providing the highest quality clinical care and ensuring excellence in mental health and learning disability services. We sought to evidence this through our approach to achieving outstanding rating by the CQC, which we achieved in 2019.
We have bold plans for service transformation across a number of our services over the next 5 years. The NHS Long-Term Plan and Mental Health Implementation Plan set out significant investment in mental health services, and over the life of this strategy, we will shape the detail of what this means for us at a local level in North Staffordshire and Stoke-on-Trent.
Our quality strategy aims to support and deliver the local mental health implementation plan, recognise the importance of focusing on quality as the developments proposed within the mental health implementation plan are implemented. We intend to strengthen our culture of strong clinical leadership, and this will be critical to the successful implementation of this strategy. To ensure success, our clinical and management practice and behaviours will be focused on distributed leadership, multidisciplinary team working, continuous improvement, all with a core purpose of providing outstanding care for our service users and their families.
During 2020, more than ever before, the impact of COVID-19 has shone a light on the health inequalities which are experienced locally, nationally, and across the globe. A number of our communities have been disproportionately directly impacted by the virus and will also feel the wider impacts of the virus in relation to the mental health and well-being for years to come. Those with mental health conditions and learning disabilities have significantly poorer health and well-being outcomes than those of the general population, including complex physical health problems and earlier death. To be outstanding in all we do and how we do it, we must all fulfill a role in tackling these inequalities.
We aim to achieve the commitments of this quality strategy through harnessing the potential contained within our workforce, our service users and carers, to further embed quality and performance using our SPAR quality priorities each year of this life strategy to provide the best care they can. So, how are we going to do this?
We aim to be the provider of the highest quality mental health and learning disability services in the NHS. We will be relentless in our pursuit of identifying and reducing harm, including human, process and systemic errors which could cause harm to people. In mental health, this will also include self-harm and suicide.
We'll have clear cycles for reviewing the effectiveness and responsiveness of our service provision with key partners across health and social care, including, most importantly, service users and carers. Our clinical staff will provide interventions and care which is evidence-based and targeted to the population we serve. It will make use of the latest technology and innovation to ensure effectiveness. We'll provide care which is person-centred and responsive to people's needs and reflective of their beliefs, culture and spirituality.
Our approach to achieving consistently high quality has 4 key components. The first one, planning for quality. We will ensure that our clinical services meet the needs of our service users and population. We will ensure clinical practice is based upon the best evidence and innovative practice using our clinicians, service users, and local, regional and national networks.
We'll have good assurance mechanisms, so we'll undertake periodic reviews using different things such as audit, internal insurance visits, peer reviews, and make sure that good care is being delivered in keeping with the terms of our CQC registration. We will identify and deliver actions to address any identified deficits.
The third, quality control. We will have effective operational management, which will monitor performance and quality metrics in clinical services and intervene when necessary to ensure quality is maintained. This will include the use of safety huddles, team meetings, and reviewing quality as part of day-to-day business as usual.
And lastly, quality improvement. We'll use QI methodology to identify, test and implement changes required to tackle complex issues. This will involve all of our clinical teams, service users, working together with QI experts in close detail with those who understand the issues most.
We will have agreed processes and structures in all services, including community-based services, to ensure that safe staffing is in place to meet the needs of the people in our communities. We will have leadership development opportunities available to all clinical and managerial staff.
We'll invest in staff to have pathways to further their knowledge, skills and careers. And we will make full use of technology to deliver outstanding care and support our staff to work effectively. We'll ensure the development of the new integrated care partnerships, our places, and primary care networks, which are our communities, are focused on quality as defined in this strategy.
The services which the Trust will provide in partnership will clearly reflect the needs of our communities. This will be empirically based on the evidence of need, and rationale of how we deliver these services will be based on what our people, both staff and service users, tell us. There will be integrated care pathways working across NHS, local government, citizens and voluntary, community and social enterprise organisations, delivering effective seamless care and treatment for our communities. We will work with our health and social care partners in our communities to identify and address health inequalities and have plans to address them.
And we will have multidisciplinary working between clinical and academic partners, including joint clinical academic roles with local universities, and all trust professional groups will be regularly publishing in academic journals. We will utilise various approaches to ensuring our services are sustainable and effective and efficient. We will use benchmarking data to challenge ourselves, identifying variation in our services when comparing ourselves with other organisations.
When identifying this variation, we'll have processes to interrogate, analyse and understand this variance to identify whether it's warranted or unwarranted variation. Where unwarranted variation exists, we will apply quality improvement methodology to drive process improvement, evidence change and spread good practice.
We'll undertake quality improvement assessments through the lens of our quality priorities, that is safe, personalised, accessible and recovery focused, to ensure that all aspects of quality are considered. And where possible, we will seek to improve quality in every organisational change process we make. We will use technology appraisals in redesigning our services to make sure that models of care incorporate innovation and enable us to respond to the needs of our communities.
Many thanks for taking the time to learn a little about our aims and ambitions for our quality strategy as we look beyond 2020.
I really look forward to hearing your views and working with you all as our fantastic future unfolds.
Hello everyone, My name is Shajida Ahmed and I'm here to talk to you about the People Strategy for 2020 and beyond. I'm delighted to introduce the key elements of our People Strategy, which we are calling our promise to support our people. The NHS People Plan, which was recently launched, highlights 4 national priority areas deemed as crucial to supporting transformation across the NHS. These priorities focus on how we support each other and foster a culture of inclusion and belonging, as well as growing our workforce and working differently to deliver patient care. Our People Strategy articulates how we will deliver on these national priorities by improving the working experience of our people in the Trust and wider across the health and social care system through our 4 People Promises. Our 4 People Promises are having an inclusive culture. We want to create an inclusive and empowering culture. Health and well-being, supporting the health and well-being of our people, which is absolutely crucial to everything we do. Engagement, listening to what our people have to tell us, and having a sustainable workforce to help you to be excellent in the jobs that you do. Our people are crucial to the delivery of excellent, high-quality, safe, person-centred care. The NHS, as we know, has huge national challenges of attracting applicants and filling vacancies, especially with a particular specialist clinical roles and at executive level. We need to deliver high-quality care today, but we also need to plan for tomorrow to ensure that we are still able to deliver this high-quality care to the people in our local communities and their changing demographics. The changing landscape of health and social care and the development of integrated care systems will require all our people to work in different ways, working more collaboratively and develop more effective partnership with other partners in our system. We have taken a broad approach to inclusion at the Trust, recognising equality groups both within the protected characteristics groups listed in the Equality Act 2020, but also recognise other groups outside of this protected set. We additionally recognise intersectionality, for example, people that do not sit in discrete boxes but have a number of different identities in one. For example, older gay trans women, young black straight men, etc. Notwithstanding this, key areas of focus for us are in developing greater equality and inclusion in relation to race, sexuality, gender, and gender identity and disability. Our People Strategy has been developed through various engagement activities with our people as we work towards creating an integrated care system. So, what are some of the key elements of our People Strategy? First is quality. We want to be seen as an employer of social inclusion, especially for people with protected characteristics. We want proportionate representation of our workforce, reflecting our local demographics and population. We want a climate of inclusion where people feel able and supported to disclose their background, and where the Trust works hard to achieve a culture of support and inclusion. And we want a just and restorative culture where these principles are embedded throughout the organisation. We want to increase the supply of quality development opportunities online and to expand our use of digital opportunities across all professions and services. We want to improve progression opportunities. Our talent strategy will be successfully embedded in the organisation, so our approach becomes ingrained in our culture and our ways of working. Talent metrics will help improve the quality of succession and workforce planning, and we will enable managers to have high quality talent conversations with their staff. For our people, the most important thing is to look after them with a comprehensive health and well-being offer which is sustained on a long-term basis. The health and well-being of our people is pivotal in terms of delivering on our people strategy, but equally our leaders are pivotal in creating this environment and culture within our teams. Our people don't exist in isolation, and neither does our Trust. We will therefore continue to be a strong partner and play a leading role in the development of our local health and care system. In particular, We will improve inclusion and our widening participation approach across both our trust and the wider system, ensuring that we engage and develop in ways that support the needs of our diverse local communities and our diverse workforce. So, a huge thanks for taking the time to learn a little bit about our aims and ambitions for our people strategy as we move beyond 2020. I do really look forward to hearing your views and working with you as our fantastic future unfolds.
So purposely within our partnership strategy, we're setting our sights beyond our immediate organisational boundaries. We want to actively consider the role we can play in promoting wider community resilience by working collaboratively with partners to reduce health inequalities and enhance health and care services. A big focus for us this year will be integrated care partnerships. So that's groups of providers, whether that's NHS organisations such as ourselves, UHM and MPFT, general practice, local authorities and voluntary sector providers working together to consider how best we can integrate services across the health and care economy. By focusing on the population of North Staffordshire, we can collectively bring care closer to home and improve outcomes for our citizens, patients and service users. Within our partnership strategy, we also want to be very clear that as an organisation, we think we can achieve more by working collaboratively with partners than we would do by simply working in isolation. In particular, we want to strengthen our relationships with primary care, specifically general practice, and the voluntary sector. So a key aspect of this will be the integration of the partnering strategy with our approach to stakeholder engagement, and a particular focus on active listening. So that means we don't simply listen for the sake of it. We will understand what we're being told, we will respond to it, and we'll be seen to do so. I also want to talk about sustainability, and specifically environmental sustainability. This has become an increasing area of focus for the NHS nationally. Included in the NHS long-term plan published in 2019 were a small number of big targets around sustainability, reducing carbon, improving air quality and the eradication of single-use plastics. In fact, our Trust Board in January 2020 signed an NHS pledge that would reduce our use of single-use plastics over the next couple of years. More recently, the NHS has now published a net carbon zero commitment and has appointed its first Chief Sustainability Officer. As we move forward, we will be publishing an SDMP, Sustainability Development Management Plan, and that will be a focal point for all our activity to drive forwards our sustainability efforts. We will also be launching a sustainability group that will have exec level chairmanship through myself and will act to coordinate the delivery of the Sustainable Delivery Management Plan. To help us frame all this work, we will be adopting an anchor institution approach, and that's a phrase that you may hear more and more over the coming years. In essence, it's a phrase which reflects the fact that we are a provider of mental health services. That is our core purpose and will continue to be so. But in so doing, we recruit staff from our local community. We consume goods and services from our local businesses, and our local schools, colleges and universities provide the skills for our workforce of the future. By working together in this way, we can both improve our services but also enhance the social and economic prosperity of our local community. few months it's been for the digital team. I think it's fair to say, along with a number of our services, that this year hasn't quite panned out as we anticipated, and we had to very quickly recalibrate our plans as we went into the spring. I will talk about the strategy, but I also just want to take a brief moment to congratulate the digital team on the monumental effort they've made over the past few weeks and months to improve the reliability and resilience of our connections, to roll out our collaborative meeting space, and to roll out our video consultation software. It's been fantastic, and it's really testament to the hard work that they've put in. Looking forward, we want to build on our successes. So already within national digital circles, we have a really strong reputation. We were one of only 4 trusts to be included in the Lorenzo Digital Exemplar programme, and in fact the only mental health trust. And more recently, we were really fortunate to be included as one of only 24 trusts nationally as part of the new National Digital Aspirants programme. And that's provided a huge opportunity for us to really deliver digital transformation at scale over the next few years. So what will that look like? We'll be bringing forward a programme of clinical readiness. This will help our clinicians have access to the right information in the right place and at the right time, whether that's at home as part of our new arrangements for agile working, or whether it's across all our estate and in the community. And that doesn't sound much, but when you consider that a large part of Northern Staffordshire is rural by nature and we have huge variation in digital connectivity, it's a really big undertaking and one that will make a huge difference to our clinical teams. We want to continue to roll out the transition of some of our services onto digital platforms. Building on the success of the CAMS Digital Exemplar, we want to extend that to other services so that service users, our clinicians and other professionals involved in their care can be more empowered to take direct control over their own care needs and arrangements. We'll also be bringing forward some targeted transformation to enhance care pathways and make sure that Lorenzo, our electronic patient record, keeps pace with end user expectations and changing clinical practice. Working together with system partners, we'll also be upgrading our technological infrastructure. This will ensure that we've got a reliable and resilient connection to all our systems, whether they're clinical or corporate, in whichever setting you choose to use them, at home, across our estate, or out in the community. And I'm pleased to say that over the next 12 months, we'll be upgrading all our connection infrastructure, starting with the Hartlands Hospital.